This is the Emergency Medical Minute.
So this is a medical minute on a little toxicology. So there was an interesting study, and it looked at basically cases of just double ingestion of a single pill. So we frequently see this. Someone comes in, they say, oh, I forgot I'd already taken my whatever, my metoprolol, and I took 2 by accident. They come in the middle of the night, and we think, all right, well, what's the big deal? So in general, a double ingestion of a single pill is a pretty benign thing. Most of the times it's totally fine, nothing to worry about. But this was a review of 10 years of the California poison control, and they found about 876 cases where a single medication was double dosed. And in general, there were very few problems. There were only 12 cases of adverse events, and in those, some severe effects were from these following drugs. Propafenone, which we don't see a lot of, but it's an antidysrhythmic that sometimes people take, and somebody had an episode of VTAC from taking a double dose. With beta blockers, patients have been found to have bradycardia and hypotension, sometimes pretty significantly just from taking a double dose. Similarly, calcium channel blockers, bradycardia and hypotension. Bupropion, which we see people on for depression, people have had seizures. And then actually just from Tramadol, which we think of as being pretty benign, there was a seizure. So in general, these ingestions are very safe. 12 out of 876 ingestions only having a problem isn't that bad, but it's something to consider, especially with the calcium channel blockers, the beta blockers, and a couple other medications. Probably worth kind of looking it up, or obviously calling toxicology or poison control before we totally blow them off, but generally benign. Any questions? Thanks, guys.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.